Hello folks, welcome to this video on the mechanics of breathing. Okay, so just really quickly, anytime you read that term mechanics of breathing in the exam, if a question comes up on mechanics of breathing, it basically means which muscles are contracting to allow you to get air in and or out of your lungs. So the mechanics of breathing means which muscles are contracting to allow you to get air in or out. It doesn't want anything about diffusion or gaseous exchange. It'll ask for those separately if it wants them. Mechanics of breathing is purely the muscles that we use to get air in and out of our lungs, to expand or contract our chest size, our chest volumes. A couple of things that you need to know, a couple of scientific principles, okay? Air is a gas, so obviously we can put air / gases, and here's the thing, always move from high pressures to low pressures. You might be thinking, why is that important? Well, you wouldn't be alive now if it wasn't true. Okay, so they're the key things that you need to know about it, and a couple of key terms. What we're going to be talking about are inspiration and expiration. These are the terms that you need to be familiar with. Inspiration, yes, you can have someone as your inspiration, someone you are inspired by, but in terms of physiology, inspiration is breathing in, expiration is breathing out. To expire air is to get it out, remove it from the lungs. Right, so firstly, inspiration, okay? Breathing in, sorry for the crude diagram, but what you've got here, as I hope you can see, is you trying to get air into your lungs. Going to go down the pharynx, larynx, trachea, bronchioles, alveoli, all that jazz. Again, remember, we're not talking about diffusion of gases or anything like that. This is about mechanics of breathing, which muscles are contracting to get air in. Now, there are a couple of things that they could ask about. Okay, so we'll just look at one down each side. How do you breathe in at rest, and how do you breathe in when you are exercising? Okay, so how do you breathe in at rest? How do you breathe in when you're exercising? Okay, at rest, there are two key muscle groups you are going to contract to help get air into the lungs, right? Number one that you should all be familiar with, this muscular tissue down at the bottom here, for those who are not familiar with it, that is your diaphragm. So your diaphragm is going to contract. Now what you might not know is when that diaphragm contracts, it's going to move downwards. So it's actually going to end up somewhere down here, like that. Awful diagram, I apologise, but you know, worse things can happen in life, can't they, I suppose. So that diaphragm is going to move down there. Right, so the diaphragm's going to contract. Also, you may have heard of these muscles called your external intercostals. Oh no, he's saying big hard words, I don't like it. Come on, you can learn these. External intercostals contract. Now, where are your external intercostals? They exist between all your ribs. Now, you will have eaten external intercostals before, probably. Where? Well, when you have your ribs. When you have your sweet and sour ribs or barbecue ribs, you are eating the intercostal muscles of a pig. That'll make you think about it in the future, won't it? But that's essentially what you're doing. Now, the external intercostals technically exist on the outside of the ribs, and that's important, and we'll come on to it why in a minute or so. But what they're going to do is they're going to pull the ribs upwards and outwards. Hence why when you take a big deep breath in, your rib cage expands. So the diaphragm's going to contract and move downwards, as we've done down here. The external intercostals are going to contract and pull the ribs upwards and outwards. What is the combined effect going to be? Now, the proper term for your chest cavity is your thoracic cavity. So I'm going to put thoracic, start that one again because that is absolutely appalling writing. So your thoracic / chest cavity, the space inside your chest, in other words, increases. Now, why is that important? Well, just remember what we said on that previous slide. Gases always flow from areas of high pressure to low pressure. If you put something in more space, if you give something more space, it is under less pressure. So all the space inside that chest, right? If I can pull the ribs upwards and outwards, if I can push the diaphragm down, I make the volume, the space inside that chest cavity bigger, so everything inside it is under less pressure, it's under low pressure. So air will now flow in from the environment where there is high pressure into the chest where there is now low pressure. And that is how air flows into your lungs. We're not a Hoover. We don't suck air into our lungs. We drop the pressure inside of our chest cavity nice and low so that air flows in from the atmosphere, from the environment where it is naturally at a slightly higher pressure. Okay? So thoracic or chest cavity increases and air flows into the lungs. Now, I apologise that this, give me a second, has just suddenly appeared, oops, on your screens in the blue writing. Just ignore that 1 second, okay? So just to quickly recap, what has happened, okay? The diaphragm has contracted and moved downwards to this lower position. The external intercostals have contracted and pull the ribs upwards and outwards in all directions. That has made your thoracic or your chest cavity even greater in volume. The volume has increased and air will flow into the lungs quicker, more effectively. Why? Because the pressure in the environment, the air pressure in the environment, all this area outside of your body is now higher than what it is inside the chest cavity. And as we said on the previous slide, air always flows from high pressure to low pressure. So by increasing the volume inside here, by making everything expand outwards, I have dropped the pressure, everything's under less pressure, and air will flow into the lungs. Now, I meant for this blue bit to appear a little bit later on. It's appeared now, not a problem. What we've then got to do is say, right, what happens during exercise? Because what do I want during exercise? I want more air to flow into my lungs. Common sense, don't I? I want more oxygen in my bloodstream. I want more air to flow into my lungs. So what happens is, as you can see, and I'll just change my arrow, blue for blue, okay? During exercise, my diaphragm and my external intercostals are still going to contract. They're going to do the exact same job they did over here. Not a problem. The diaphragm's going to move down to there. The external intercostals are going to pull the ribs upwards and outwards. So the chest, thoracic cavity is still going to increase and air is going to flow in. But as I said, I want more air in my lungs. So I'm going to use more muscles to make this thoracic cavity as large as it can possibly be. There's two key muscle groups I'm going to use. Number one, the pectorals. Now, if we could superimpose the pecs onto this diagram, they would sit here. Your pectorals, your upper chest muscle groups. They are going to contract as well. And because your pecs sit on top of the ribs, on the top part, they are attached to your ribs. So when the pecs contract, they are going to pull the top sets of ribs up and out even further. They're going to help the external intercostals expand the rib cage in the top part as much as is humanly possible. But you might have been dreading thinking, oh my God, what is this word? Sternocleidomastoid. That is the muscle. If I'm going to contract my sternocleidomastoids now, and you'll hear my voice has changed, your sternocleidomastoids are all the muscles in your neck. So if you contract all the muscles in your neck, you'll feel it go very tight, your voice will change a little bit, and they're your sternocleidomastoids. Now, if we look at the diagram, they will exist from there to there, up and down your neck. They attach onto the lower part of your jaw, but they most crucially attach onto the top few sets of ribs. So when these contract, they're also going to pull the top few ribs upwards and outwards even further, which is what these red arrows are indicating here. Now, the combined effects of the diaphragm, the external intercostals, obviously you'll see I've abbreviated it to EICs. Don't do that in the exam, they won't give you the mark, but I was just running out of space. So the diaphragms, the external intercostals, the pectorals, and the sternocleidomastoids are all going to contract, and that is going to make the rib cage as big as you can possibly make your rib cage. That thoracic chest cavity is now going to be as big as it possibly can be, and the air is going to flow in as much as it possibly can. You're going to get as much air into your lungs as possible. So make sure you can identify the changes between inspiring at rest and inspiring during exercise. Now, please forgive this diagram. There's some unintentional writing here. Ignore it. This is a picture taken from a textbook and I just couldn't crop the writing out. But we'll make do with it. It'll be absolutely fine. Expiration, breathing out. Okay? And again, there's two things they can do here. They can say rest and exercise. What is going on? Okay, we shall tell these examiners what is going on. Now we're trying to get air out of the lungs. Okay, we're trying to expire air. We're trying to get air back into the environment. Hence why you will see we have got a couple of arrows here that are going upwards and outwards. Air is exiting. Oh, look at all these blue arrows on this diagram. Air is exiting the lungs and going back into the environment. Now remember the things that we said about pressure and volume. If you increase the volume of something, if I made my chest or thoracic volume bigger, pressure will drop and air will flow in. But I want to expire now. I want to breathe out. So what I've got to do, I've got to make this chest volume small. I've got to make the volume nice and small so that the pressure increases. Everything is getting squeezed. The pressure is increasing, so that will force air back out into the atmosphere, back into the environment. That's what I'm trying to do when I'm expiring, when I'm undergoing expiration. So, here's a couple of key terms that you need to know. At rest, expiration is called a passive process. Now, think back to when we looked at flexibility stretching. You had active and passive stretching. Active, you actively stretched yourself. You contracted one muscle to stretch another. Passive was where you didn't have to contract any muscles. A partner stretched you for you. You didn't have to do anything. Now that is exactly what we mean by passive, by expiring at rest being a passive process. You don't contract any muscles to breathe out at rest, right? What happens is your diaphragm and again I'm abbreviating, I apologise, don't do this in the exam. My EICs relax. Now what is the effect there? Remember, my diaphragm is this muscle here, my EICs, my external intercostals, are the muscles between my ribs. When my diaphragm contracted, it pulled down. Now it's relaxing, it's pushing back up. Okay? When my external intercostals contracted, they pulled the ribs upwards and outwards. Now they are relaxing, the rib cage is falling back inwards. And that is causing the entire thoracic or chest volume to decrease. That is all getting smaller in there. The volume is decreasing. So, thoracic volume decreases. Your pressure increases as a result inside that chest, inside that thoracic cavity, and as a result, air flows out. Air is going to move upwards and outwards and out back into the environment, because now the pressure inside the chest is higher than what it is in the outside space outside your body. So air flows from high pressure inside the chest to low pressure outside of your body. Okay? And because no muscles are contracting, it's all relaxing, we call it a passive process. Now, why have I pointed that out? They might say that in a question. Describe what passive breathing is. Describe expiration as a passive process. We are talking about expiration at rest, because what's going to happen now during exercise, when I need to force the air out the lungs quicker, because remember, this air is now full of carbon dioxide and that's a toxin. During exercise, expiration is going to become an active process. I'm now going to have to contract some muscles to get air out quicker and get it out in higher volumes. Now, I mentioned we had external intercostals. We also have muscles called internal intercostals. Now, these are muscles that again exist in between the ribs, and if you just look at the diagram, I'm drawing slight little red lines, but they exist on the inside, holding the ribs together on the inside of your chest. The external intercostals held the ribs together on the outside. The internal intercostals are mirror images. Think of it like that. Mirror images of the external intercostals. Now, as you might expect, or as you might be piecing together now, the internal intercostals are going to contract, because remember, we are now at an active process. Okay, the internal intercostals are going to contract and pull the ribs down and in. And that's going to make the thoracic volume smaller, as I'm sure you could have guessed, okay? So the external intercostals have relaxed, okay? But also now the internal intercostals are contracting to pull those ribs down quicker. Remember, when your external intercostals relax, the rib cage will just fall back down normally, as it's doing at rest. The point is, during exercise, that's not happening quickly enough. We need it to happen quicker. So the external intercostals are going to relax, but then the internal intercostals are going to contract to pull the ribs. Think of it this way. Here's the easiest way to remember it. If something is external, it is outside of you. So when the external intercostals contract, when they did when you were breathing in, breathing in, they pull the ribs up and out. They pull the ribs externally. Now that your internal intercostals are contracting, what is internal? It's things inside. So when your internal intercostals contract, they're going to pull the ribs in, down and in, back towards the centre of your body. Okay? Finally, the last big change here is this. The diaphragm is going to relax and it is going to elevate itself back upwards and again make that thoracic volume smaller, make it decrease. However, we've got one other tool. Okay, we've got one other weapon we can use. What else is going to happen? Your abdominals, your six-pack. Your abdominals are also going to contract. Now, where are your abdominals? I'm about to draw the worst six-pack in the world here, okay? But think about it, your six-pack is here. Technically, it should be an eight-pack, okay? You do have abs lower down as well, okay? But your six-pack sits there. When you contract your abs, so they sit right in front of your diaphragm. When your diaphragm is contracted and pulled down to here, they are right behind your top sets of upper abdominals, okay? So what happens when you contract your abs? Well, when you contract your abs, they are going to literally push that diaphragm back up. It's like someone giving you a little bit of a dig in the abs. It's going to force that diaphragm upwards quicker, which is going to make the chest cavity reduce faster. So it's again going to make the thoracic volume, the thoracic chest size, decrease very, very quickly. So the abdominals are going to contract. Okay, the abdominals are going to contract and force your diaphragm up quicker. So as we've said, the diaphragm is going to relax and that's going to move up as it does at rest. But the point is, at rest, it's not going to move up quick enough. I need to be breathing out much quicker. So by contracting my abdominals, I'm going to push that diaphragm up even quicker. The chest volume is going to be nice and small and compact. Air pressure, the pressure is going to build inside and force the air out into the atmosphere, out into the environment. So that is how we breathe in and out at rest in comparison to exercise. Have a watch through that video as many times as you need to. Check out the information in your booklets and have a go at the tasks in there. Good luck with it, folks.